I'm an optometrist and been practicing for 38 years in optometry. Well, my father was an optometrist, and so I was indoctrinated at an early age. An optometrist is a doctor of optometry, and so we have the ability and we're licensed to evaluate patients for their vision. We do complete vision evaluations, both optical and medical. We treat eye disease. We treat binocular vision problems, patients who have problems coordinating their eyes. We also work in the areas with children for pediatrics. We work with seniors. We work with patients of all ages. Well, we even examine infants. We start at 6 months of age, and we have a program where we encourage parents to bring their babies in. So we start really young and educate parents how important vision is and how vision development is an important part of actually creating a good foundation for that child as they go through school. Then we examine, all kinds of patients, both from the standpoint of patients who just have normal types of vision problems, where they have a refractive error, they might be nearsight, farsight, or have astigmatism. But also we see a lot of patients that have neurological problems, patients who come in with headaches. We see diabetics, with patients who have macular degeneration, and that's an area where we get into which is called low vision. Today, going into optometry, it's required that they have a degree. Usually it's a degree in science, and they have to satisfy prerequisites for getting into an optometry program. Once they're accepted into the optometry program, it's a 4-year program, and some of the graduates, before they graduate, they would like to go into doing residencies, and we have residencies in many different areas in optometry. Well, we have to be licensed within the state that we practice. So I have a license in California. When we graduate, we take national board exams. And some of those national board exams do allow doctors to practice in multiple states, but then they still have to, there's individual requirements for each state that has to be satisfied beyond the national boards. Well, that's a great question because today things have been changing a lot over the years, and now you're seeing optometrists in many different settings, such as some commercial settings, HMO settings. There's a lot of doctors, optometrists employed in the VA. They're employed by medical institutes, work with ophthalmology. So there's quite a lot, just like in occupational therapy where you have a lot of opportunities for many different areas of specialty and different environments that you can work in. The same thing holds true within optometry. I have a special practice, so I have a lot of collaboration with occupational therapy, and sometimes more with occupational therapy than I do with my own colleagues. I would say in a given week, I'm talking to occupational therapists probably 4 out of 5 days. Well, usually the occupational therapists are bringing the patient here to my office. So that could be a patient who has a stroke, that could be a patient who had a traumatic brain injury, or any other kind of neurological event. And I work closely with several hospitals myself. So I work with occupational therapists in the hospital setting as well as in my private practice. We have trained a lot of occupational therapists in vision in terms of doing vision evaluations and actually, you know, getting them their mindset on how important vision is in terms of the rehab of the patient. So occupational therapists are now really keying in on the problems with these patients in their daily living skills that's related to their vision problems. And so when they see that, they're more likely wanting to refer a patient here and or get some advice about what to do. Well, yes, I you know, just as an overview, when you're working with patients in your settings, okay, in the various settings that occupational therapists work, there's so much involved in terms of vision. And when you think about daily living skills, lots of times the patient's rehab, their actual progress, is actually influenced by their lack of ability to use their visual systems accurately. And for instance, patient who has problems with coordination of their eyes or eye movements, they're going to have difficulty even with their mobility skills because their visual system is giving them inadequate information about where they are in space. And so they're more likely to make misjudgments about where things are, and more likely to have a secondary injury, a fall, another head injury. And so getting the patient in early on for treatment with a neuro optometrist is actually a very good thing to do, because that's a point that I think more and more occupational therapists are starting to really get that picture. And we work, optometry and occupational therapy are like two professions that were meant to work together.
Hey Zoe, so today we're just going to continue with some of the initial assessments. And for this one, all I want you to do is to just fill in the rest of the numbers in the clock. So you'll go from 12 all the way to 11. Okay, you want to make sure to leave enough space for all the numbers to fit in there, equally spaced. So Zoe, remember that you have a lot of space. You have this whole clock. Make sure you're using up all that space there. Okay, you all done?
Yeah.
Okay, you made sure to scan the whole area?
Mm-hmm.
All right.
Hi.
Hi.
I'm Chelsea. I'm the neuro optometrist here.
Okay, I'm Caitlin, the occupational therapist.
Nice to meet you.
Nice to meet
Zoe.
you.
Hi.
Yeah, so we just finished up some of our initial testing, and I just noticed a few things going on with Zoe's vision. So we wanted to come in and get like a second opinion from you.
Perfect. Okay. So we are going to be doing a test. It's called the constellation test. What I want you to do is basically circle all the stars that are small. So it'd be one like this. Okay, can you do that for me? Sure. Remember, you have the whole paper to do that. Okay, thanks for that.
So this was the original assessment that we had done in the clinic that I wanted to show you, because you just kind of jammed all these numbers here.
I see, all on the right side.
Yeah.
Same with my test here, is all on the right.
Okay.
So it seems that she has some left neglect. I'm going to look at the rest of her assessments, and then we're going to formulate a plan and see
Okay.
what we can work on her so she'll be able to use her left side.
Yeah. So
I'm just going to give you a call.
all right. Sounds great. It was
Thank
really
you.
nice meeting with you.
It was nice
today.
meeting with you too.